I'm really thankful to the organizer for inviting me to share with you some of the experiences we lived in Italy during this COVID-19 pandemic. The perspective of my speech is the one that is proper of the president of the Italian National Institute of Health. The other important things to stress at this point is that Italy was the first European country that has been hit by the pandemic, and so also the response was the first on European level, and a very quick response was needed. In this slide, you can see the curve, the evolution of the curve, and the measure adopted right from the beginning. One of the measures at the end of January was the choice of the government to declare the emergency status, and just after a few hours to in charge the civil protection to manage the situation. And the head of the civil protection then nominated a team of experts, scientific and technical experts, under the name Scientific and Technical Committee, that with the aim to support the decision and the management of the pandemic. As you know, in the second part of February, Italy was hit very hard by the emerging new cases, and starting from some area in the northern part of Italy where the spread of the virus was evident. Then very quickly the spread was involved also surrounding areas and spread all over the northern part of Italy. In this slide, you can see the evolution of the pandemic during all its course. So right from the beginning, then the second wave in autumn 2020, and then the third wave at the spring 2021. To afford this pandemic is just a challenge for a country, and the challenge needs to put together different kind of institution. And in this slide, we try to just focus all the institutions that have been involved, and of course also National Institute of Health, but other institutions like regions, like ministries, Ministry of Health as a first, other, and of course civil protection. This is the slide where the first Scientific and Technical Committee was set up at the beginning of the pandemic, and you can see some of the pictures that show us the team was in the room, the emergency room, where the team convened almost every day during the beginning of the pandemic. This is the second edition of the Technical Scientific Committee that has been renovated a few months ago, and was a little bit reduced the number of experts, and they were more focused on scientific experts. In this slide, you can see the role and the mandate of the scientific committee, Technical Scientific Committee, and so the main task is to support on technical scientific basis the action of the needed for overcome the COVID-19 emergency. Technical Scientific Committee depends on the civil protection, and civil protection is part of the team of the Prime Minister. Duties of the civil protection during the emergency, not just the pandemic, but during all the emergency and crisis, is the coordination of the responses to emergencies or crisis, is the organization of the needed intervention through also extraordinary procedures in order to be very quick and effective in the adoption of the measure, the support all the needs of the population involved, and of course intervene to guarantee the continuity of all public health services, including of course healthcare. Technical and Scientific Committee interacted continuously during these months of the pandemic with, certainly first of all with the Ministry of Health, but also with all other ministries that needed any support, scientific or technical. In this slide, you can see the area where the support and the written opinions have been provided. And as you can see, we go from healthcare, that is obvious, to cruise ships, to thematic parks, to public transportation, to hotel facilities, to beaches and cinema, theaters and museums. Of course, the opinions were related to the measure to be adopted in order to close or keep open these kind of activities. And as you can imagine, it was a very hard work to do. Overall, when the number of decline and the expectation from the population and from the different categories were very high to reopen as quick as they could. In the next slides, the term lockdown is the keywords, and lockdown was right at the beginning one of the extraordinary measures adopted, but then the terms lockdown evolved as a common language in Italy, and we had the need to reproduce, to adopt lockdowns in different phases of the pandemic. The next slide is social distancing, is the key word, and still ongoing as a problem, because we know that social distancing is one of the pillars, let's say, of the control of the circulation of the virus. And in many instances, CTS have been asked to respond, to decline, to specify the meaning of social distancing in different contexts, in different phases of the pandemic. The further slide is about citizen resilience. This, of course, is not part of CTS activity, but is part of the Italian response to the pandemic. And you can see some headlines of some newspaper just stressing the fact that overall in the first part of the pandemic, Italians were very, very keen to adopt all the recommended measures. And this just contributed to a rapid decline of the number of cases after the peak at the beginning of March. Another very important issue that was just characteristic of the CTS activities that met almost every day during the first part of the pandemic is the activity or the recommendation for hospitals, for clinical pathways, for recommendation of use of PPE inside and outside hospitals, or supporting disinfection and other kind of activity. And of course also supporting the Ministry of Health and the Civil Protection with advice for setting up the hospital resilience. At the same time, Italy did a very great job, as many other countries, certainly for industry resilience, because one of the big challenges at the beginning was just to provide enough masks for healthcare professionals, but for whole population. And so, of course, from this point of view, CTS contributed to do that. Of course, also National Institute of Health at the National Institute, other institution in Italy, stressed and did a very great work in a very few days to guarantee the evolution, the setup of the production of great millions of masks every day. Another challenge illustrated in this slide is the reopening school. It was a great challenge overall in September 2020, and it will be in the next September also. And CTS contributed with some opinions to the work done also by other institutions. CTS was asked also to propose opinions, to provide information, and within a chaotic situation like the infodemic we are living during this pandemic. Springtime last year, we set up, the government set up also a methodology to monitor. I'm just showing very quickly some slide to monitor the evolution of the pandemic, and so we had a color-based reporting weekly about the risks, about the evolution of the pandemic in each region. And this is something still ongoing. Vaccination is now, as you can see in the next two slides, the challenge, and so CTS also contributed with some opinions to the organization of the campaign that has been done by a special commissioner that was in charge to the practical, operational, logistic aspect for this pandemic. Activities within this pandemic, I want just also to stress the activities that National Institute of Health did. In this slide you can see the sequences of the activities like preparedness, like identification of and surveillance, like studying single cases, perhaps all the dead register about for COVID-19, and studies specific for disinfection, guaranteeing information, guaranteeing training, guaranteeing evidences through the booklets and all available in our website to train people and to also to guarantee the coverage of the media. And in this slide you can see how the distance learning impacted in the numbers of people that have been trained to courses providing credits by our institution is very huge. We are speaking about more than 500,000 professionals involved in this training. And professionals are at the center of our consideration. And as you can see in this slide, of course they need ability, they need the training for public health, they need core competencies, they need a lifelong learning, they need preparedness. And overall for public health professions that are the core of the answer in the public health perspective for this COVID-19 experience, interaction with policymakers is also a great challenge. Some of the elements of we can just summarize from this experience that through some keywords, like let's say preparation, of course, like readiness, flexibility, prevention of public health, decline both at local level and global level, or local level if you want, if you like. The central role of human resources in terms of planning and training them continuously. The role of fragile people and the elderly is the category that have been heavily hit by this pandemic. And of course also the digitalization is another challenge and emerging opportunity, and also this Congress we can do that, we can share our opinion thanks to these opportunities. Finally, I don't want to avoid to mention the fact that this pandemic make really evident the need to work in the communication and with the social media, and to cope with the heterogeneity of the discussion and the news provided. In conclusion, you know that our country was abruptly hit by the pandemic, and that to face the circulation. And we adopted the lockdown very effectively. During these months, we enhanced our preparedness, and we developed and shared with other countries many tools. We launched a mass vaccination, and also we strengthened the surveillance of viral variants. And of course, the challenge now we are living is of modulation of the measure, to look at the circulation of variants, to guarantee a vaccination coverage, and also to work together to share the best practices for facing possible future pandemics. I thank you very much for your attention, and just in the last slide, I can show you our websites where you can find all the material and the documentation that Italian National Institute of Health provided during this pandemic. Thank you very much.